Whenever you want, you're good.
I'm ready.
Go.
Okay. Is it possible that you or someone you love is addicted to prescription drugs? An estimated 48 million people, according to the National Institute on Drug Abuse, have used prescription drugs for non-medical reasons in their lifetime. It was a huge epidemic in my high school and surrounding schools. I've lost relationships with people close to me due to their prescription drug abuse, which has caused me to do a lot of research and studying on this topic. Unfortunately, drug addiction is growing rapidly throughout the United States and is affecting all age ranges. Drug addiction, more restrictions should be placed because people think that since they're being prescribed by their doctors, that it's okay to abuse them. And I've come to realize that unfortunately everyone knows someone who is addicted to prescription drugs. And today I'm going to just discuss what types of prescription drugs are being abused, how it affects your life and health, and possible ways to overcome the spread of addiction. I'm going to focus on three main topics. Types of prescription drugs, the harm that they cause, and ways to overcome the spread of addiction. The three different classes of prescription drugs are opioids, which are used to treat pain, such as oxycodone, Vicodin, and Roxicet. Depressants, which are used to treat anxiety and sleep disorders, such as Xanax, Valium, and Klonopin. Stimulants, which are used to treat attention deficit disorders, such as Adderall and Ritalin. Opioids can cause drowsiness and constipation, and long-term effects could cause severe respiratory depression, which is when your respiration fails to provide full ventilation to your lungs, or in highest doses it can cause death. Antidepressants as well as anti-anxiety can cause sexual dysfunction, weight gain, and fatigue. And with the use of these drugs, there's a chance you can be physically uncoordinated for the first few days till you build your tolerance. Stimulants can cause enhanced brain activity, increased alertness in energy, elevated blood pressure, and increased heart rate, increased respiration, and sleep deprivation. Ultimately, these three drugs possess the same long-term effect when abused, and high potential for physical dependence and addiction. Physicians should ask about any and all drug abuse. They should screen prescription drug abuse, and it can be incorporated into routine medical visits. They should take note of rapid increases in the amount of medication needed. Patients should follow directions and be aware of potential interactions with other drugs, and they shouldn't change their dose without discussing it with their doctors first, and they should never use another person's prescriptions. And why is prescription drug addiction on the rise? Doctors actually don't know exactly how many people are addicted to pain medication, but so many people are is because of the availability. According to Prescription Drug Addiction, a book written by Rod Calvin, vastly more people have access to medicines today over 15 or 20 years ago. Responding to patients in pain advocacy groups, doctors may have become less restrictive in prescribing opioid pain pills. There has been a surge in prescriptions for opioids over the past decade. Also, according to a book called Painkiller, written by Barry Meyer, teen drug abuse with opioids is now only second to marijuana in popularity. Almost 1 in 10 high school seniors report taking hydrocodone, which is Vicodin, which is used to treat pain, within the past year. And not by coincidence, many of their parents are also taking Vicodin. Some addictions, such as opioid addiction, can be treated with medications, and these pharmacological treatments counter the effects of the drug on the brain and behavior, and can be used to relieve withdrawal symptoms, help overcome drug cravings, or treat an overdose. Although a behavioral or pharmacological approach alone may be sufficient for treating some patients, but research shows that a combined approach may be best. So in conclusion, I've discussed types of prescription drugs, the harm that prescription drugs can cause, and ways to overcome the spread of addiction. People living in today's society must be aware about the dangers that prescription drugs can cause them, as well as the people around them. Drug addiction is such a widespread epidemic, and all of the people with potential of losing control of their lives by abusing drugs. 1 in 10 people have recovered from drug abuse, so let's keep hope alive and do everything we can to help our loved ones overcome this rapidly increasing addiction. Thank you.
Very good.